Question 1. Which of the following best describes the primary function of the kidneys? A. Filtration of waste products from the blood. B. Production of hormones that regulate blood pressure. C. Regulation of electrolyte balance. D. All of the above. Answer: D. All of the above. Question 2. When caring for a patient with acute renal failure, which laboratory result is most indicative of renal impairment? A. Elevated serum potassium level. B. Decreased creatinine clearance. C. Decreased blood urea nitrogen (BUN) level. D. Increased hemoglobin. Answer: A. Elevated serum potassium level. Question 3. In which part of the nephron does most of the reabsorption of water and solutes occur? A. Proximal convoluted tubule. B. Distal convoluted tubule. C. Glomerulus. D. Loop of Henle. Answer: A. Proximal convoluted tubule. Question 4. A nurse is preparing to administer a diuretic to a patient with hypertension. Which electrolyte imbalance should the nurse monitor closely? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypocalcemia. Answer: B. Hypokalemia. Question 5. Which of the following is the most appropriate nursing action when a patient is receiving 4 fluids for dehydration and their urine output drops significantly? A. Increase the 4 flow rate. B. Assess for signs of fluid overload. C. Notify the healthcare provider immediately. D. Administer a diuretic as ordered. Answer: C. Notify the healthcare provider immediately. Question 6. The renal threshold for glucose is typically exceeded in which condition? A. Diabetes insipidus. B. Type 1 diabetes mellitus. C. Hypertension. D. Chronic kidney disease. Answer: B. Type 1 diabetes mellitus. Question 7. What is the primary function of the antidiuretic hormone ADH? A. To regulate blood pressure by constricting blood vessels. B. To stimulate the kidneys to excrete sodium. C. To increase water reabsorption by the kidneys. D. To increase urine production. Answer: C. To increase water reabsorption by the kidneys. Question 8. Which statement accurately describes the role of the renin-angiotensin-aldosterone system, RAS, in the body? A. It causes vasodilation to lower blood pressure. B. It helps maintain fluid balance by increasing sodium retention. C. It decreases aldosterone secretion. D. It directly regulates urine output. Answer: B. It helps maintain fluid balance by increasing sodium retention. Question 9. A patient with nephrotic syndrome is at risk for which of the following complications? A. Hyperkalemia. B. Hypovolemia. C. Respiratory acidosis. D. Hypercalcemia. Answer: B. Hypovolemia. Question 10. In which situation should a nurse question the administration of a potassium-sparing diuretic? A. The patient has renal failure. B. The patient has hyperkalemia. C. The patient is on ACE inhibitors. D. All of the above. Answer: D. All of the above. Question 11. The most common cause of acute glomerulonephritis in adults is A. Diabetes mellitus. B. Streptococcal throat infection. C. Hypertension. D. Autoimmune disorders. Answer: B. Streptococcal throat infection. Question 12. Which of the following is the best method to assess a patient's hydration status? A. Measuring serum sodium levels. B. Assessing urine-specific gravity. C. Monitoring blood pressure trends. D. Checking capillary refill time. Answer: B. Assessing urine-specific gravity. Question 13. A nurse is caring for a patient post-kidney transplant. What is the most important priority for nursing care during the first 24 hours? A. Monitoring for signs of infection. B. Assessing the kidney function through urine output. C. Ensuring pain management. D. Educating the patient on long-term medications. Answer: B. Assessing the kidney function through urine output. Question 14. A nurse is teaching a patient with chronic kidney disease about dietary changes. Which food should the nurse advise the patient to limit? A. Apples. B. Bananas. C. Chicken. D. Rice. Answer: B. Bananas. Question 15. Which of the following is a sign of early-stage acute kidney injury, AKI? A. Increased creatinine levels. B. Hyperkalemia. C. Oliguria. D. All of the above. Answer: D. All of the above. Question 16. In which condition is hematuria most commonly observed? A. Urinary tract infection, UTI. B. Bladder cancer. C. Renal stones. D. All of the above. Answer: D. All of the above. Question 17. A nurse is preparing to administer an intravenous 4 contrast agent to a patient scheduled for a CT scan. Which patient condition increases the risk for nephrotoxicity from the contrast agent? A. Hypotension. B. Diabetes mellitus. C. Chronic kidney disease. D. All of the above. Answer: D. All of the above. Question 18. What is the most common complication following a cystectomy? A. Hypertension. B. Urinary tract infection. C. Bleeding. D. Respiratory failure. Answer: B. Urinary tract infection. Question 19. A patient presents with flank pain and hematuria. What is the most likely diagnosis? A. Pyelonephritis. B. Urinary tract infection. C. Renal calculus, kidney stones. D. Glomerulonephritis. Answer: C. Renal calculus, kidney stones. Question 20. Which is the most appropriate action when a nurse observes that a patient with a Foley catheter has not voided in 8 hours? A. Increase the 4 fluid rate. B. Assess for bladder distension and notify the healthcare provider. C. Remove the catheter and apply an external catheter. D. Continue to monitor the patient's condition. Answer: B. Assess for bladder distension and notify the healthcare provider. Question 21. Which of the following hormones directly influences the excretion of sodium in the kidneys? A. Antidiuretic hormone, ADH. B. Renin. C. Aldosterone. D. Parathyroid hormone. Answer: C. Aldosterone. Question 22. What is the primary effect of a loop diuretic on the kidneys? A. Increase sodium reabsorption. B. Inhibit the reabsorption of water in the proximal convoluted tubule. C. Block the sodium-potassium chloride symporter in the loop of Henle. D. Stimulate the release of aldosterone. Answer: C. Block the sodium-potassium chloride symporter in the loop of Henle. Question 23. In which situation should a nurse prioritize assessing for fluid retention in a patient with nephrotic syndrome? A. The patient reports fever and chills. B. The patient has a history of congestive heart failure. C. The patient is taking corticosteroids. D. The patient experiences sudden weight gain. Answer: D. The patient experiences sudden weight gain. Question 24. Which of the following is the most likely cause of polyuria in a patient with untreated diabetes mellitus? A. Increased production of aldosterone. B. Increased glucose in the urine. C. Excessive fluid retention. D. Decreased antidiuretic hormone secretion. Answer: B. Increased glucose in the urine. Question 25. A nurse is caring for a patient with bladder cancer. Which of the following is a priority assessment for this patient? A. Monitoring for signs of urinary retention. B. Assessing for signs of hematuria. C. Checking for fever and chills. D. Monitoring for electrolyte imbalances. Answer: B. Assessing for signs of hematuria. Question 26. A patient undergoing dialysis is at risk for which of the following complications related to fluid imbalance? A. Dehydration. B. Hyperkalemia. C. Pulmonary edema. D. Respiratory alkalosis. Answer: C. Pulmonary edema. Question 27. Which of the following is a typical finding in the urine of a patient with acute pyelonephritis? A. High levels of protein. B. Presence of red blood cells. C. High specific gravity. D. Increased pH. Answer: B. Presence of red blood cells. Question 28. The role of the distal convoluted tubule in renal function is primarily to A. Filter blood to form urine. B. Reabsorb most of the filtered sodium. C. Regulate pH and sodium balance. D. Secrete waste products into the urine. Answer: C. Regulate pH and sodium balance. Question 29. Which of the following conditions is most likely to cause decreased renal perfusion? A. Hypertension. B. Heart failure. C. Hyperkalemia. D. Hypokalemia. Answer: B. Heart failure. Question 30. A nurse is caring for a patient with nephrolithiasis. Which of the following interventions would be most appropriate to promote comfort and prevent complications? A. Encourage high fluid intake. B. Limit fluid intake to prevent overload. C. Encourage bed rest to reduce strain on the kidneys. D. Administer sedatives to promote relaxation. Answer: A. Encourage high fluid intake. Question 31. A patient with chronic kidney disease is experiencing pruritus. Which of the following is the most appropriate explanation for this symptom? A. Decreased production of erythropoietin. B. Accumulation of uremic toxins. C. Increased serum calcium levels. D. Reduced blood flow to the skin. Answer: B. Accumulation of uremic toxins. Question 32. A nurse is teaching a patient about the use of a Foley catheter. Which statement indicates that the patient understands the instructions? A. I should use the catheter for as long as I need to. B. I need to keep the catheter bag above my bladder to prevent infections. C. I will report any signs of leakage or infection. D. I do not need to clean the catheter area regularly. Answer: C. I will report any signs of leakage or infection. Question 33. A nurse is assessing a patient with acute kidney injury, AKI. Which of the following findings would be the most concerning and require immediate intervention? A. Decreased urine output. B. Decreased creatinine levels. C. Decreased serum potassium levels. D. Hypertension. Answer: A. Decreased urine output. Question 34. A nurse is reviewing the lab results of a patient with end-stage renal disease, ESRD. Which of the following results is most likely to be abnormal in this patient? A. Serum sodium of 140 milliequivalent/L. B. Serum calcium of 10.5 milligrams per deciliter. C. Serum phosphorus of 7.5 milligrams per deciliter. D. Serum creatinine of 0.8 milligrams per deciliter. Answer: C. Serum phosphorus of 7.5 milligrams per deciliter. Question 35. The primary cause of dehydration in a patient with diabetes insipidus is A. Excessive urination due to lack of ADH. B. Inadequate fluid intake. C. Increased sodium retention in the kidneys. D. Inability of the kidneys to concentrate urine. Answer: A. Excessive urination due to lack of ADH. Question 36. A nurse is caring for a patient with a history of kidney stones. Which of the following dietary recommendations should the nurse provide to help prevent future stones? A. Increase intake of calcium-rich foods. B. Limit sodium and oxalate intake. C. Avoid drinking fluids throughout the day. D. Increase vitamin C intake. Answer: B. Limit sodium and oxalate intake. Question 37. A nurse is educating a patient on the use of a potassium-lowering agent. Which statement by the patient indicates a need for further education? A. I will avoid eating potassium-rich foods while taking this medication. B. I will monitor my blood pressure regularly. C. I should drink plenty of fluids to help with the medication's effects. D. I will only take the medication when I feel lightheaded. Answer: D. I will only take the medication when I feel lightheaded. Question 38. The primary purpose of peritoneal dialysis is to A. Filter excess waste products and fluids from the blood using the abdominal lining. B. Increase the filtration rate of the glomerulus. C. Stimulate erythropoiesis. D. Lower blood pressure through sodium excretion. Answer: A. Filter excess waste products and fluids from the blood using the abdominal lining. Question 39. A nurse is assessing a patient with a possible urinary tract infection, UTI. Which symptom would most likely indicate a complication, such as pyelonephritis? A. Burning sensation during urination. B. Flank pain and fever. C. Blood in the urine. D. Urinary urgency. Answer. B. Flank pain and fever. Question 40. A nurse is preparing to administer an 4 antibiotic to a patient with acute pyelonephritis. What is the priority nursing action before administering the medication? A. Assess the patient's blood pressure. B. Verify the patient's allergy history. C. Obtain a urine culture and sensitivity test. D. Ensure the patient is well hydrated. Answer. B. Verify the patient's allergy history. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.